Okay, welcome back. So this is going to go over some of the instructions pre and post-op and kind of what the expectation is as far as that goes. If you hear something rustling around in the background, possibly barking, I do have my little Chihuahua here. Her name is Ellie Bean. Maybe I would get more views if she was on here the whole time, but she's very much a distraction. But she likes to jump all over me, scratch at things. So I just want to let you know, if you hear that, that is her. Okay, so pre-op instructions. If you've ever had surgery before, you would know what these are. I'm not going to be able to look directly at the camera while I'm reading a lot of this, but I'll try to do my best. No driving. Absolutely no driving by yourself. Nothing to eat or drink 8 hours prior to surgery. No grapefruit or drink grapefruit juice for 7 days before sedation. Not sure what that is about, but I'm sure it's something. No alcohol or recreational drugs 24 hours prior. No caffeine for 24 hours prior to sedation. And I was like, wait, what? I'm a big coffee drinker, and I do drink some energy drinks during the day, especially for working out. So I was like, okay, I guess I can do that. No smoking for 24 hours before. I don't smoke cigarettes or marijuana, so that doesn't apply to me. Wear loose-fitting garments and a shirt with short sleeves. Should a patient develop a cold, flu, sore throat, or any other illness, the doctor will evaluate the patient and make a decision on whether or not to reschedule. Medications should be taken as part of the sedation treatment. They will be prescribed, and the name of the drug, dosage, and instructions will be given to the patient. So those are the items that they will call in for me a couple of days prior to the surgery. Continue taking your usual medications as prescribed. I do have an antibiotic they're giving me. I do know that. And they did note, take the antibiotic the morning of surgery. Remove nail polish and acrylic from at least one finger for the monitoring device. I want to say that I did speak to the anesthesiologist, and she said I did not have to do that. And I do think that they are able to put something on your ear if they can't use your finger. I do have gel polish on my nails, so no contacts, no glasses, no jewelry, no watches, and then they want to ensure that you're not pregnant or nursing. So it also has a notation. This is an interesting one. If the procedure is a long surgical procedure, you will be given an incontinence undergarment to wear. You may want to bring a change of clothes. So that was interesting to me. I did not expect that. I guess the sedation is probably going to be 5 to 7 hours. During that time, it's general anesthesia. You're completely out. Now, the last maybe 2 hours of that, they will bring you up from that slightly, but you're still going to be completely under. There's no catheterization during this process. So, in the event that your bladder empties, they give you a Depends undergarment to put on so that you do not make a mess. I didn't think about that, but it makes sense. I really hope it doesn't happen, because that's super embarrassing, and I don't know. I just don't want that to happen. Anyway, post-sedation instructions. Basically, what you would expect. Go home and rest for 24 hours. Don't perform any strenuous activities for 24 hours. Don't try and eat a heavy meal right away. Just do some liquids or soft foods. Nausea may occur. Lay down. Have some cola, ginger ale. If it persists for more than 4 hours, call the surgeon's office. Take medications only as directed. and any unusual symptoms or questions, to go ahead and reach out to them. You do have a sedation caregiver information sheet. This is just giving the information about who's going to take care of you, who's going to be your driver on that day. That person needs to stay there. You know, obviously go out for lunch or whatever, because it is a very, very long day, but they will need to stay there in case there's some type of emergency. You can't just get Ubered over there and then have an Uber pick you up. No, that is not an option. So post-op care, I can see now that I'm almost 6 minutes in. So maybe I will stop it here, cut this video, then make another video for that, because I want to go over some of this so that you have all the information. So I'm going to do that. I'm going to cut this video now, and then I'll start up, make another video. So we're going to see this in increments, probably 3 to 4 videos just on this information, but I think it's important information, so I want to get it out there in an appropriate manner. Okay.